Good morning all and welcome. So today we will discuss anti-malarial drug. So first of all, first we discuss about the life cycle of the malaria. So we know that malaria is caused by a plasmodium. Malaria is a plasmodium parasite that is spread by a female Anopheles mosquito. So these are the different species of the plasmodium parasite, that is Plasmodium knowlesi, Plasmodium falciparum, Plasmodium vivax, Plasmodium ovale, and Plasmodium malariae. So, the symptoms of the malaria include high fever, chills, headache, myalgia, and the GI symptoms. So, let's discuss the life cycle of the malaria. Suppose this is our skin, and mosquito will came and bite on our skin. Then they will release the sporozoites. These sporozoites will uh, come in the blood vessels, and from the blood vessel they will immediately invade into the hepatocytes. From the hepatocytes, some of them will release in the form of merozytes, and they will come in the RBCs, and some of them will go and hide in the liver. These are known as the hypnozoites. So these merozoites will come into the RBCs, and after the come into the RBCs and get matured, and they rupture the RBCs. So whenever the RBC get ruptured, there is an increase in the body temperature. So some of them will mature and form a trophozoites and form then gametes, and these gametes are again taken up by the female mosquito. So this is all about the life cycle of the malaria. So we have the four stages here. So the first stage is erythrocytic stage, second stage is pre-erythrocytic stage, third stage is exoerythrocytic stage, and the fourth stage is gametocytic stage. So what happen here, first of all, the sporozoites will come. Sporozoite will go into the liver and invade into the hepatocytes. From the hepatocytes, some will go into the RBCs, where it get mature and rupture the RBCs. And some of them will go into the exoerythrocytic stage, where some of them will hide, and some of them will get mature and form a gametes, and these gametes are taken up by the female Anopheles. So this is all about the life cycle of the malaria. Here we have four stages: erythrocytic stage, pre-erythrocytic, exoerythrocytics, and the gametocytic stage. So here what happens in the erythrocytic stage? See, the what happen in the erythrocytic stage? In the erythrocytic stage, these RBCs get ruptured. So whenever it get ruptured, there is a increase in the body temperature. So what happen in the erythrocytic stage? There is a symptoms will occur. In the erythrocytic stage, the symptoms of the malaria will occur. And what happen in the pre-erythrocytic stage? Pre-erythrocytic stage, in this, the sporozoites will come into the hepatocytes. So whenever the sporozoites will come, they will cause the malaria, because from the pre-erythrocytic stage, some of them will go into the exo, and some of them will go into the erythrocytic stage. So the pre-erythrocytic stage is the main cause of the malaria. So next is the exoerythrocytic stage. In this stage, some of them will come and some of them will come and hide there. So they will release slowly and go into the RBCs, so that they can rupture the RBCs. So exoerythrocytic stage is the main cause of the malaria, that cause the relapse of the malaria. So exoerythrocytic stage is responsible for the relapse of the malaria. Next is the gametocytic stage. This is the fourth stage that is responsible for the transmission of the malaria, because in this stage the female Anopheles come and take their gametes, and then spread into the another one. So this is the main. So fourth one is the main transmission stage. So we have four stages: erythrocytic stage, pre-erythro, exo, and hematocytic stage. Erythrocytic stage is responsible for the symptoms. Pre-erythrocytic stage is responsible for the cause, and the exoerythrocytic stage is responsible for the relapse, and the hematocytic stage is responsible for the transmission. So if we target these four stages, we can manage the malaria. So these are the drugs which are written with the red one. So these are the drugs. If we target these four stages, then we can cure the malaria. So there is a one drug, that primaquine. It will act on the all the stages, but not on the erythrocytic stage. So remember, guys, this is a primaquine, and primaquine. This will act on the all the three stages, but not on the erythrocytic stage. So on the pre-erythrocytic stage, we have drug like primaquine, proguanil, tetracycline, and on the exoerythrocytic stage, we have primaquine, and on the erythrocytic stage, we have drugs like chloroquine, quinine, mefloquine, artemisinin, halofentrin, sulfadoxine, pyrimethamine. This is used in a combination: proguanil, tetracycline, and on the hematocytic stage we have primaquine, chloroquine, and quinine. Remember, guys, primaquine will act on the all stages but not on the erythrocytic stage. So this is all about the life cycle of malaria. Here the point to be remembered, that Plasmodium vivax or Plasmodium ovale. This two Plasmodium will cause the relapse. Means only this vivax and ovale will show the will go into the erythrocytic stage and cause the relapse. So now let's get discuss this drug one by one. So these are the anti-malarial drugs which are used in the management of the malaria. So these drugs are first is 4-aminoquinoline derivative. It includes chloroquine. Second is quinoline and methanol derivative. It includes mefloquine. Then the third one is cinchona alkaloids. It include quinine or quinidine. Fourth is bignite. It include proguanil. Then fifth one is diaminopyrimidine. It include pyrimethamine. Next is 8-aminoquinoline. It include primaquine like drugs. Then seventh is sulfonamides and sulfone. It includes sulfadoxine, sulfa-methylpyrazine. Then comes the antibiotic. In this we use tetracycline, doxycycline, clindamycin like drugs. Then sesquiterpene lactone. In this it include artemisinin derivative, that is artesunate, artemether, arteether. Then amino alcohols, it include halofentrin like drugs. Then comes the uh, nephridine analogs. In this drug include like pyronaridine like drugs. Then comes the neptoquinone. In this there is atovaquone like drugs. So let's get discuss this drug one by one. So now we will discuss the drug one by one. So our first drug is chloroquine. So the mechanism of action of this drug is that basically hemoglobin will convert into heme, and this heme will convert into hemozoin. So these hemozoin are liked by the parasite. These are non-toxic to parasite, but this heme is toxic to parasite. This heme is converted into hemozoin with the help of a enzyme heme polymerase. So what chloroquine will do? This chloroquine will inhibit the heme polymerase enzyme. If heme polymerase enzyme get inhibited, then there will be no formation of hemozoin, which is loving by the parasite. So there will be accumulation of the heme there, and this heme is toxic to the parasite. So there are some other drugs also which inhibit the heme polymerase, like quinine and mefloquine. So remember guys, here chloroquine, quine and mefloquine will inhibit the heme polymerase enzyme. So remember, in the starting of the video, I said chloroquine will act on the two stages. One stage is erythrocytic stage, and the second stage is gametocytic stage. So what happened in the erythrocytic stage, it will inhibit the heme polymerase, and in the gametocytic stage, what will this drug do? It will accumulate in the food vacuoles of the parasites, and it will raise its temperature. Basically, food vacuoles of parasite need the acidic environment, but this drug gives the basic environment and create the basic environment there, so that the parasite will not survive and they will die. So remember one thing more, that P. falciparum is resistant to chloroquine. Now chloroquine is used in the malaria, but it have other uses also, like it is used in the management of rheumatoid arthritis, lupus erythromatosis, in leprosy, ingidiasis it is used, and recently we have seen it is also used in the management of the COVID-19. So these are the some side effects of the chloroquine, that it causes nausea, vomiting, uncontrollable itching, it causes the hemolysis, especially in the G6PD deficient patient, it causes the blurring of the vision, it causes retinopathy, and also causes the periphery neuropathy. So this is about the chloroquine. Remember, chloroquine will inhibit heme polymerase. It acts on the two stages. First one is erythrocytic stage and second one is gametocytic stage. So this is all about chloroquine, and important point is chloroquine is resistance to the P. falciparum, that is Plasmodium falciparum. Now the second drug is quinine. Remember, quinine will also inhibit this enzyme heme polymerase. So there is a accumulation of a heme which is a toxic to the parasite. So it will inhibit the heme polymerase enzyme. So the uses of the quinine, that it is used in the management of the malaria, but it is also used in the nocturnal leg cramps. Quinine is also used in the management of the nocturnal leg cramps. So the side effect of the quinine include synchronism, hypoglycemia, hypotension, and hyperinsulinemia. These are the side effect of the quinine. Remember, we have quinidine and the quinine. Quinidine drug is more cardiotoxic as compared to the quinine, and the quinine drug is safer in the first trimester of the pregnancy, and even it is used in the first trimester of the pregnancy. But one thing, when we gave this quinine drug to a pregnant woman, we have to monitor their blood glucose level, because it causes the hypoglycemia. So this is very important point for the quinine. Now the next third drug is mefloquine. So mefloquine also inhibit this enzyme heme polymerase. Remember, chloroquine, quinine, and mefloquine will inhibit the this enzyme heme polymerase. So this drug is mainly used for the resistance purposes, that if chloroquine is resistance, or any other drug is resistance to P. falciparum strain, then we give this mefloquine like drugs. So this drug is used in the resistance strain of a P. falciparum. So the recently FDA has given a black box warning for the mefloquine, that it will cause the neurological and the psychiatric adverse effect, and it will also cause the vivid dreams. So this is very important point, that FDA recently gave black box warnings for the mefloquine, that it caused the neurological and the psychiatric adverse effect. So next drug is primaquine. The exact mechanism of this drug is not known yet, but some of the hypothesis that it will generate the reactive oxygen species or it will interfere the electron transport in parasite, so that the after that the parasite will not survive, and then that. So remember, very important point for the primaquine, that primaquine causes the hemolysis in the G6PD deficient patient. So and it is contraindicated in the pregnancy. So suppose if we give a primaquine to a G6PD patient, so we have to give this the dose of the primaquine very precisely to the G6PD deficient patient. So it is active, it is inactive against the erythrocytic stage. Remember, primaquine is a drug which act on the three stages. First is pre-erythro, second is exo-erythro, and the next one is chromatocytic stage. But remember, primaquine is inactive against the erythrocytic stage. So next drug is antibiotics. Generally, these drugs are used in a combination with the other antimalarial drug. In this category include tetracycline, clindamycin, doxycycline. These all three drugs are the protein synthesis inhibitor. How they inhibit the protein we elaborately do when we do the antibiotics chapter. For now, you only have to remember that it will inhibit the protein synthesis. So these are the slow acting blood cytotoxics, and then they cause the death of the progeny because they will stop the protein synthesis. And due to the adverse effect of the tetracycline on the bones and the teeth, so it is contraindicated in pregnancy and as well as child younger than 8 years. So this is about the tetracycline and the clindamycin. So next drug is pyrimethamine, proguanil and sulfadoxine. These all three drugs possess the same mechanism of action. So the mechanism of action of this drug are here the PABA, glutamate and pitridine will together will form a dihydrofolic acid, and this with the help of folic acid synthase enzyme, and this dihydrofolic acid is converted into a tetrahydrofolic acid with the help of dihydrofolate reductase, and then the protein synthesis or a DNA synthesis will occur. So these are the drugs like pyrimethamine and proguanil will inhibit the dihydrofolate reductase, and the sulfadoxine, that is sulfonamide analog, will inhibit the folic acid synthase. Some other drugs also act on these enzymes like paraminoxalic acid and dapsone and trimethoprim and methotrexate will inhibit the dihydrofolate reductase. So these are the drugs that possesses the same mechanism of action. So this is about these drugs. So next category of a drug include the artemisinin and its derivative. These are most commonly used antimalarial drug. In this category include dihydroartemisinin, artemether, artesunate and arteether. The mechanism of action of this drug is that it will generate a free radical and that alkylate or oxidize the macromolecules in the parasite and cause the death of a parasite. So there are some recommendation by the WHO that artemisinin is a very short acting drug, so it is generally used in a combination. Like artemether is used with lumefantrine, artesunate will use with mefloquine, and artesunate will use with amodiquine. Then artesunate will use with sulfadoxine and pyrimethamine combination. So all the artemisinin derivative are used in a combination. So some of the combination like artemether and lumefantrine causes side effect like headache, anorexia, dizziness and myalgia. So usually the artemether and lumefantrine are taken with the food or with the milk. If patient vomits within a 30 minutes, then we have to repeat this dose. So and the very important point is artemisinin derivative will act on the erythrocytic stage, but and these drugs are contraindicated in the first trimester of the pregnancy. Usually the quinine is used in the first trimester of pregnancy, but the point here to remember is that if we use a quinine in the first trimester, then we have to monitor the blood glucose level because it causes the hypoglycemia. So this is all about the brief about the drug. Now the next is the mosquirix. So it is a vaccine against the malaria. So generally it is approved in 2015 around by European agency. So the side effect of this is include irritability and the injection side reaction like the pain and the swelling. So this is all about the brief about the anti-malarial drugs. Thank you.